Dear audience, Assalamu alaikum. I am Professor Shamsudjaman, Professor of Pathology. I welcome all in today's lecture on pathology. Today, 26th lecture on pathology. Today's topic is edema. These are the cells, or if these are the cells, in between the cells there is intercellular space. Intercellular space is called interstitial space. Dear audience, in normal anatomical and physiological condition, there is certain or minimum amount of fluid in between the cells, that is in the interstitial space. If this fluid is excess, then it is called edema. Again in serous cavities like pleural cavity, pericardial cavity, synovial cavity, peritoneal cavity, all are the serous cavities, and within these serous cavities in normal physiological and anatomical condition there is certain amount of fluid. If this fluid is excess in this serous cavity, by definition it is called edema. So, excess accumulation of fluid in the interstitial space or in the serous cavities is called edema. Now, come to if excess accumulation of fluid occurs in the serous cavity, what is the terminology? Pleural effusion, it means excess accumulation of fluid in pleural cavity. Excess accumulation of fluid in pleural cavity is called pleural effusion. It is called pleural effusion. Pericardial cavity, excess accumulation of fluid in pericardial cavity is called pericardial effusion. So, if excess accumulation of fluid in pleural cavity, it is called pleural effusion. Excess accumulation of fluid in between the visceral and parietal layer of the pleura. Excess accumulation of fluid in between visceral and parietal pericardium is called pericardial effusion. Synovial effusion, excess accumulation of fluid in synovial cavity is called synovial effusion. Ascites, excess accumulation of fluid in peritoneal cavity. Excess accumulation of fluid in peritoneal cavity is called ascites. Dear audience, if this is the lung, you know there is visceral layer of pleura and there is parietal layer of pleura, and this is the potential space, and this potential space naturally contains certain amount of fluid. If the fluid is excess in this space, this is called pleural effusion. Suppose this is the heart, and you know there is visceral layer of pericardium and there is parietal layer of pericardium, and there is potential space in between two layers, and there is certain amount of fluid in physiological condition. If the fluid is excess in this potential space, then it is called pericardial effusion. This is the joint space and this is the synovial cavity, and there is certain amount of fluid in normal physiological and anatomical condition. If this fluid is increased in this space, it is called synovial effusion. Excess accumulation of fluid in the peritoneal cavity, it is called ascites. Ascites is also called peritoneal effusion. My dear audience, now come to what are the types of edema. Edema is classified as two. One is local edema, another is generalized edema. First come to local edema. Examples of local edema: one is acute inflammatory edema. Edema found in acute inflammation is called acute inflammatory edema. Dear audience, you know what is inflammation? Reaction of vascularized living tissue to local injurious agent, provided the injurious agent does not destroy the tissue, and this reaction of the vascularized living tissue to local injurious agent is called inflammation. And you know there are cardinal signs of acute inflammation. One is rubor, calor, dolor, tumor and functionalisa, and tumor is nothing but swelling, and this swelling is nothing but acute inflammatory edema. Allergic edema. Dear audience, you know on exposure to allergen, sometimes there is swelling in the skin, and this is nothing but edema in the skin due to allergy. Edema due to venous impairment. Dear audience, if there is venous impairment of venous drainage at any part of the body, there will be swelling, and this is local edema due to venous impairment. Example: One is leg edema following long journey. Again, leg edema due to long standing. Dear audience, if anybody experiences long journey or long standing, his or her leg undergoes swelling, and in that case there is a bit difficulties to wear the shoes, due to edema in the leg, and this leg edema due to impairment of venous return due to long standing or due to long journey. Then lymph edema. What is this? Edema due to lymphatic obstruction. Dear audience, you know lymphatic channel drainage lymph from the tissue. If there is lymphatic obstruction, what will happen? There will be no drainage of lymph. So, at that part there will be edema, and this is called lymph edema due to obstruction of lymphatic channels or due to lymphatic obstruction. Example, filariasis. Dear audience, you know in elephantiasis there is swelling of the leg, and it is nothing but filariasis, and it is nothing but lymph edema, and it is due to lymphatic obstruction. These are the local edema. Now come to generalized edema. It is hepatic edema, cardiac edema, renal edema, edema in nutritional deficiency. Then edema in pregnancy. These are the generalized edemas. Besides this, mixed edema, then edema of unexplained cause. So, these are the generalized edema. Edema following liver disease is called hepatic edema. Edema following heart disease, cardiac edema. Edema following renal disease, renal edema. Edema in nutritional deficiency, edema due to nutritional deficiency, it is edema in nutritional deficiency. Edema in pregnancy. Mixed edema, it is found in case of hypothyroidism in adult, found in hypothyroidism usually in adult. Now come to edema of unexplained cause. Why there is generalized edema? The cause cannot be explained well. If anybody suffers from edema of unexplained cause, you can see sometimes the ring of the finger become loose, sometimes it is become tight. This is nothing but edema of unexplained cause, and it is cyclical edema, or also called periodic edema. So, edema of unexplained cause, it is cyclical edema or periodical edema. Now, come to clinical classification of edema. Clinical types of edema, it may be pitting edema and non-pitting edema. Another is non-pitting edema. Now, come to example of non-pitting edema. Now, come to example of non-pitting edema. Elephantiasis. That is filariasis. Dear audience, now come to why in filariasis or in elephantiasis the edema is non-pitting. Why non-pitting? Dear audience, you know, if this is the lymphatic channel and this is the lymph node, lymphatic channel, this is the lymph node. In filariasis, what happens? In filariasis, lymphatic obstruction. As there is lymphatic obstruction, there is no drainage or minimum drainage of lymph from the tissue. No drainage or minimum drainage of lymph from tissue. So, there is accumulation of lymph in the tissue, accumulation of lymph in tissue. Due to accumulation of lymph in tissue, there is irritation. There is irritation in tissue, and due to irritation, there is chronic inflammation. There is chronic inflammation. Chronic inflammation. Dear audience, you know, chronic inflammation is associated with fibrosis. So, there will be fibrosis. And you know, where there is fibrosis in the tissue, where there is fibrosis in the tissue, there will be hardening. So, due to fibrosis, there is non-pitting edema. Dear audience, now come to what are the common causes of edema. I mean, what is the pathophysiological categories of edema? Whatever may be the type of edema, there are some common causes. These are called common causes of edema, or also called pathophysiological categories of edema. What are those? One is increased hydrostatic pressure, in blood. Increased hydrostatic pressure in blood. Dear audience, you know, within the blood vessel, if this is the blood vessel, there are two types of pressure. One is hydrostatic pressure, another is colloidal osmotic pressure. you know, due to hydrostatic pressure, fluid comes out of blood vessel through the interendothelial junction in the tissue, and due to colloidal osmotic pressure, blood draws water from outside from the tissue within the blood vessel. So, due to colloidal osmotic pressure, water is drawn from the tissue through the interendothelial junction in the blood. This is the role of hydrostatic pressure and colloidal osmotic pressure. If there is increased hydrostatic pressure, there will be excess fluid coming out from the blood vessel in the tissue through the interendothelial junction, and it causes excess accumulation of fluid in the interstitial space, and this is edema. Number 2, decreased colloidal osmotic pressure in blood. Dear audience, I have told you the colloidal osmotic pressure is associated with drawing of fluid from the tissue through the interendothelial junction in the blood. If colloidal osmotic pressure is decreased in the blood, what will happen? You know, more than 80% or about 80% colloidal osmotic pressure is maintained by albumin. So, if there is decreased colloidal osmotic pressure following hypoalbuminemia. So, if there is decreased colloidal osmotic pressure following hypoalbuminemia, what will happen? There is decreased amount of albumin within the blood. So, there is decreased colloidal osmotic pressure. As there is decreased colloidal osmotic pressure, blood cannot draw the fluid from the tissue through the interendothelial junction sufficiently. So, there will be accumulation of fluid outside the blood vessel in the interstitial space, and there will be edema. Now, come to what are the common causes of decreased albumin or hypoalbuminemia. What are the causes of hypoalbuminemia associated with edema? Causes of hypoalbuminemia. One is decreased synthesis of albumin by liver, as in cirrhosis of liver. As in cirrhosis of liver, there is decreased hepatocyte number, so there is decreased albumin synthesis. Another one is there is sufficient or normal synthesis, but excess excretion of albumin via kidney, proteinuria, as in nephrotic syndrome or in nephritis. There is no decreased synthesis, there is no proteinuria, still then there is hypoalbuminemia. What may be the cause? It is due to nutritional deficiency. Another one is there is no decreased synthesis of albumin, no proteinuria, no nutritional deficiency, still then there is hypoalbuminemia. What may be the cause? It is nothing but the malabsorption syndrome, like malabsorption syndrome. One of the most important malabsorption syndrome associated with hypoalbuminemia is Crohn's disease. Dear audience, now come to clinical importance of edema. What is the clinical importance of edema? if edema first appears in dependent part like ankle, if edema first appears in dependent part like ankle, it indicates cardiac edema. That is, it is edema due to heart disease. If edema first appears in face, it indicates renal edema. Edema, the cause within the kidney, that is following nephritis, that is edema, and so edema first appears in the face. If edema first appears in the abdomen, that is, if there is first ascites, it indicates edema due to liver disease, that is edema following cirrhosis of liver. If edema, that is ascites first, it indicates hepatic edema. So, these are the clinical importance of edema. Now, come to hepatic edema in details. Dear audience, you know this is the liver. If edema due to liver disease, it is called hepatic edema. What are the liver diseases associated with hepatic edema? Hepatic edema means edema due to liver disease. What are the diseases of liver associated with hepatic edema? The first and foremost cause is cirrhosis. Cirrhosis of liver, then hepatitis sometimes, and hepatic malignancy, hepatic carcinoma. These are the causes of hepatic edema. Now, come to mechanism or pathogenesis of edema or pathogenesis of hepatic edema in cirrhosis of liver. Pathogenesis of hepatic edema in cirrhosis of liver. Dear audience, you know this is the portohepatitis. This is the portohepatitis. The first and foremost pathogenesis is portal hypertension. Portal hypertension, then hypoalbuminemia, then lymphatic obstruction, and then secondary hyperaldosteronism. So, these are the pathogenesis of edema in cirrhosis. First come to portal hypertension. Dear audience, you know in cirrhosis there is fibrosis. Due to fibrosis in liver, liver is contracted. So, there is fibrosis in liver. As there is fibrosis in liver, the porta hepatis may be contracted. Contraction of porta hepatitis. Contraction of porta hepatis. As there is contraction of porta hepatis, the portal vein is compressed. Compression of portal vein. As compression of portal vein, what will happen? As compression of the portal vein, there will be no drainage or a minimum drainage of blood from the portal circulation of the abdomen. So, there will be accumulation of blood in portal system. As accumulation of blood in portal system, there will be increased hydrostatic pressure. Increased hydrostatic pressure in portal system. And due to increased hydrostatic pressure, there will be outcoming of water from the portal system in the peritoneal cavity, that is transudation. That is transudation, and due to transudation there will be ascites. Dear audience, I have told you here transudation. You know exudation and transudation. Exudate is the acute inflammatory fluid and transudate is the extravascular fluid due to increased hydrostatic pressure in blood. Then come to hypoalbuminemia. How hypoalbuminemia occurs in cirrhosis? Cirrhosis of liver. As in cirrhosis of liver, there is fibrosis, contraction of liver, so there is decreased hepatocellular number. In cirrhosis, there is decreased hepatic mass. As there is decreased hepatic mass, there will be decreased synthesis of albumin. Dear audience, you know albumin is only synthesized in physiological condition from the liver, not from other tissues. As liver is diseased, there is decreased hepatic mass, so there will be decreased albumin synthesis. As decreased albumin synthesis, there is hypoalbuminemia. And you know hypoalbuminemia is associated with edema. So, there will be edema, that is there will be edema throughout the body. If there is compression of the porta hepatis first, the patient come to you first with ascites. If there is no compression of the porta hepatis in cirrhosis, but there is hypoalbuminemia, there may not be ascites. As hypoalbuminemia occurs throughout the body, so there will be generalized edema. Again, cirrhosis with no compression of the porta hepatis, there will be no ascites or there will be delayed ascites. But as cirrhosis is associated with decreased hepatic mass, so throughout the body there will be decreased albumin. So, in cirrhosis there is generalized edema without any ascites or with delayed ascites. Another one is lymphatic obstruction in cirrhosis. Dear audience, you know porta hepatis in anatomical condition contains 1 or 2 lymph node here. So, lymph is drained from the abdominal cavity through these lymphatic channels. If there is compression of the porta hepatis, the lymphatic channel also will be compressed there. As there is compression of this lymphatic channel, lymph will not be drained and this limb will enhance the ascites. So, lymphatic obstruction due to fibrosis of liver. Lymphatic obstructions at the port hepatis due to fibrosis of liver. Lymphatic obstruction at porta hepatis due to fibrosis of liver. No lymph is drained. So, enhancement of ascites. Now, come to secondary hyperaldosteronism. Dear audience, we know from physiology, aldosterone is associated with absorption of sodium at the distal convoluted tubule of the nephron, and there is half life of aldosterone. You know, liver is the largest organ, it is the important organ of metabolism. The aldosterone is degraded within the liver. If the liver is diseased, if there is decreased hepatic mass following cirrhosis, the degradation of aldosterone will be delayed. So, half life of aldosterone will be increased. Secondary hyperaldosteronism. How it occurs? Cirrhosis, decreased hepatic mass, delayed degradation of aldosterone. As there is delayed degradation of aldosterone, half life of aldosterone is increased. What it means? Half life of aldosterone is increased means aldosterone gets maximum time or more extra time to act upon the distal convoluted tubule of the nephron. So, acts upon distal convoluted tubule and causes retention of salt. And as you know, salt is osmotically active particle, sodium is osmotically active particle. So, as there is retention of sodium, so there is retention of sodium and also water. Retention of sodium and water. So, there is increased blood volume, and due to increased blood volume there will be increased hydrostatic pressure in blood. Increased hydrostatic pressure in blood. Again, retention of sodium and water causes increased blood volume, and due to increased blood volume there will be increased hydrostatic pressure in blood, and due to increased hydrostatic pressure in blood there will be transudation and edema. So, this is the pathogenesis of hepatic edema. Now, come to pathogenesis of cardiac edema. Dear audience, you know, if this is the heart, you know, heart pumps, blood comes out. Again, heart relaxes and blood comes within the heart. This is normal physiology. If edema following heart disease, it is called cardiac edema. Now, come to what are the diseases of heart associated with cardiac edema. The important cause of heart disease associated with cardiac edema is right heart failure. And it is called congestive cardiac failure, CCF. So, if anybody suffers from right heart failure or congestive cardiac failure, how edema occurs? And this is nothing but pathogenesis of cardiac edema in CCF. Now, come to pathogenesis of cardiac edema in CCF. Number 1, increased hydrostatic pressure in blood, and number 2, salt and water retention. Now, come to how increased hydrostatic pressure occurs in blood following CCF or in CCF, in congestive cardiac failure. Increased hydrostatic pressure in CCF. How? Dear audience, right heart failure, if anybody suffers from right heart failure, minimum blood enters into the right atrium via the superior vena cava and via the inferior vena cava. So, if CCF, that is right heart failure, what will happen? As there is impaired venous drainage via the superior vena cava and inferior vena cava due to right heart failure, what will happen? There will be accumulation of blood in venous system. As accumulation of blood in venous system due to right heart failure, there will be increased hydrostatic pressure in venous blood. As increased hydrostatic pressure in venous blood, there will be transudation and edema. Now, come to salt and water retention in CCF, how it occurs. Salt and water retention in CCF, how it occurs. Dear audience, you know, if there is right heart failure, there will be accumulation of blood in the venous system. So, there will be decreased cardiac output. As impairment of venous return in congestive cardiac failure, what will happen? There will be decreased cardiac output. There will be decreased cardiac output. As there is decreased cardiac output, there will be diminished blood flow through the kidney. There will be decreased renal blood flow. As there is decreased renal blood flow, what will happen? You know, due to decreased renal blood flow, there will be a release of renin from the juxtaglomerular complex, you know from the physiology. As renin is secreted, renin angiotensin axis is activated. Renin angiotensin axis is activated. If this renin-angiotensin axis is activated, what will happen? There will be release of aldosterone. From adrenal. As there is release of aldosterone, you know aldosterone acts upon distal convoluted tubule and there is retention of sodium and water. Acts upon distal convoluted tubule, so there is retention of salt and water. And retention of salt and water is associated with increased blood volume, and increased blood volume is associated with increased hydrostatic pressure, and increased hydrostatic pressure is associated with translation and edema. These are the pathogenesis of cardiac edema. Now come to renal edema. Dear audience, you know nephritis, that is acute glomerulonephritis, and nephrotic syndrome is associated with renal edema. In case of nephritis or in acute glomerulonephritis, there is oliguria. Due to oliguria, there is retention of salt and water in the blood, and so there is edema. In case of nephrotic syndrome, there is heavy proteinuria. Due to heavy proteinuria, there is hypoalbuminemia in blood, and due to hypoalbuminemia in blood, there is edema. So, this is the pathogenesis of renal edema briefly. What is Anasarca? Severe generalized edema with subcutaneous tissue involvement is called Anasarca. Dear audience, again, severe generalized edema with subcutaneous tissue involvement is called Anasarca. In Anasarca, there is generalized edema, and this form of edema is very severe, and there is accumulation of the fluid in the subcutaneous tissue also. And in Anasarca, patient cannot take respiration normally, there is shallow respiration, there is hurried respiration. This is called Anasarca, and Anasarca usually found in renal edema and usually in nephrotic syndrome. This is all about the edema today briefly. Thanks all.